What are some of the top concerns that you all are addressing through your work at Chai? So there's concerns that will be more important to providers versus payers and health systems or administrators versus patients.
Our thought from the beginning is that none of this work should be done in silos. So we recognize that conversations needed to be had in this multi-stakeholder way. That poses a lot of challenges also because the goals of each of these groups are somewhat different. Like we could say in healthcare, everyone's goal is to make sure that the patient is okay and that they're getting the care that they need and that everyone has access to care. But for us, but the reality is there are competing priorities always.
What are some of the key strategies or tactics and tools that you all are recommending or implementing for that?
We run a lot of work groups that focus on use case specific best practices. What does a developer need to know to be able to develop this kind of tool responsibly? And what does an implementer need to know to implement these tools and use them responsibly? And at each stage of this process, at the pre-implementation or post-implementation, what metrics and measures should we be looking at to ensure that tools are useful and usable, that they are effective, that they are fair, safe and secure, maintain privacy, et cetera.
What do you see right now is an example of success in implementing AI and measurable kind of results from that?
So there are intrinsic measures of effectiveness, and then there are extrinsic measures of effectiveness. Like ambient scribe is a really good example of something that lots of people want to adopt. If the goal of ambient scribe is to increase provider time with the patient, that might be a more challenging end goal than to say, oh, it reduces the time that they're documenting notes. We also have this access issue, right? If a provider is saving time, then potentially they have time to see more patients, not necessarily just spend more time with that one patient, right?
There is so many initiatives out there, right? And if I am a digital health company that builds an AI solution, who should I listen to?
I think this is where Chai's role as a convener really comes in. So anytime we have a new use case, we'll bring in folks that are developing solutions in that use case. We'll bring folks who are interested in implementing or are already implementing these use cases. And then we have a conversation around like, how are you using it? How are you monitoring it? What are you measuring? What is reasonable in this space, in this time right now?